Hey guys, this is Dr. Chaffin from SI. Today I wanted to talk, a little tip of the day is sales. That is a word that a lot of people don't like. Dentistry's not sales. Well, actually there's two words, sales and profits. Oh, don't talk about that. Well, I'm going to talk about it today because sales is important, okay? In business, you've got to have a sales force and you've got to market your business. So when people come in, you can actually sell a product, and everything is in sales. Okay? So what I want tip of the day is look at, in a dental practice, who sells dentistry. 90% of doctors, the doctor actually does everything. He doesn't let his assistant talk, he doesn't let his hygienist talk, he doesn't let anybody talk, he does everything. How many practices you know if you're a new patient, you go on and the first thing you know is you meet your dentist. And he does everything himself. Times are changing, guys. Now that's one doctor selling, and you know guys, quite frankly, most doctors suck at doing it. So, what the tip of the day is who is the sales force in your office? It's your entire team, guys. From the front answering the phones to your treatment plan coordinator and all the way through. So, how do we sell dentistry and be okay with it? So there's one principle you want to do is always be ethical, just, and don't over treatment plan. So that's the common denominator. I'm not overselling. I'm doing a treatment plan is ethical, honest, and just. So how do we make the patient say yes? How do we sell dentistry, so to speak? You have a sales force. And your sales force, like for example, and this is just a little bit, is I like to split teams up. For example, and everybody can relate to this, team 1 and team 2. Team 1 is your assistant and your doctor. Now in a practice, when does that happen? Limited exams. Now, a lot of practices, the doctor comes in and does everything. And they don't want their assistant to talk. They don't want them to build relationships. The doctor says this, and then the fastest they get the treatment plan coordinator in there, and the faster they can get the patient out. So this is the flow. You have your team, assistant, doctor, they come to a limited exam, and it flows into your treatment coordinator. My main point of the day is train this team. This is the section where everything gets broken down. If the doctor does all the sales, you're gonna suck. But if you do combine your skills and talk to the patient, and we can go further in depth with that on some other time, sometime else, but we do that at the Institute, by the way, is work on this section so when it comes to the treatment plan coordinator, the case will close. It's called closing ratio. If the treatment plan coordinator has 10 patients and she's doing 10 treatment plan presentations, how many does she close? Most offices, treatment plan coordinator knows one thing: numbers. Because this team doesn't tell her what clinically is relevant, gets her ready. Clinical and financial is what this person over here needs to know in order to create the value and actually close the case. And in business, we call these closers. So my general thing is sales training is very important in dental practice. Find somebody that you trust to get more training in these departments. Stage 1 cases are what a lot of practices do. New patient comes in, does their thing, they present, patient leaves. I like to stage 2 a lot of cases. Stage 1 is your first appointment, you're gathering information, you're creating the value, you're building your relationship. Your team all the way through is building and you're planting seeds on treatment. I mean, if my assistant says that the thing needs a crown and I come in and I ask them, yeah, that tooth needs a crown. Jenna said it. No. The patient's going to holy cow, his assistant's awesome. So it comes across as a unified team and very educated. So in a practice, stage 2ing is you gather information, then you tell the patient, hey, listen, I'm going to kind of take a couple hours tonight. We're going to book you for another consult out of the operatory, maybe in the consult room, and we're going to kind of go over. You're going to meet with me again and the treatment plan coordinator. We're going to discuss your budget, your goals, make sure that we are choosing the right treatment plan for you that you feel really good about. That's how you close dentistry. So the tip of the day is work on your sales training. Look at your team as a sales force. They're your team. You live and die together, guys. So if you like that kind of information, I'm Dr. Chaffin from SI Institute. And if you want more information, click on the link below. Get scheduled for our next course. We go into a lot of this stuff, which is really healthy for the dental industry. Thanks much. Take care.